that was prepared by United Healthcare, but this is not a United Healthcare event. We offer all the major providers, Aetna, Humana, most of the major providers, but United Healthcare was kind enough to give us this nice educational presentation, and the pens, and so we do that for you. So this is about Medicare and how Medicare works, to give you a little knowledge on the topic. And this is the first time I've used this, so let me see how this is going to work. Okay. It's going to take a second for me to get oriented here. So we're going to answer 10 questions, which will appear on the screen right now. The first one, of course, is what is Medicare, but what is Medicare? Who can get Medicare? What does Medicare cover? How much does Medicare cost? Where can I get more coverage? How do I choose? How do I enroll? When can I change my coverage? How can I save money? And where can I go for help? Now, does anybody know when Medicare was founded? Can you yell it out if you know? When was Medicare started? 1965. Actually, Medicare, the idea of Medicare goes back to 1912, when Teddy Roosevelt was running as a third-party candidate. He first proposed it. The first formal proposal for Medicare was made by President Harry Truman in 1946. And after that, President Eisenhower and President Kennedy both supported it, but they weren't able to get it through Congress, but President Johnson got it through Congress in 1965. Now, since then, it's been updated by President Clinton, President George W. Bush, President Obama, and President Trump. So you can see it's supported by both parties. It's a bipartisan program. It is arguably the most successful government program in history. When Medicare was started back in 1965, I know you guys are a little too young probably to remember that, but I do. I remember 1965. My grandpa died when he was 63, and it was not uncommon back in those days for people to die in their 60s. However, today, 60 is like middle age. I mean, people live to 100, and most people live into their late 80s, 90s, over 100, and it's even going to get better as the diseases are conquered. And a lot of that has to do with advances in science. A lot of that has to do with access to medical care, which is provided by Medicare. And so that's why Medicare is one of the most successful programs. So what is Medicare? Is it a welfare program? Is it a giveaway program? No, Medicare is an insurance program. It's a health insurance program that you contribute to. It's supported by the workers and people who are on Medicare. Medicare Part A, your hospital coverage, is taken out of your paycheck in the form of FICA deductions when you're working. Medicare Part B is paid for when you're retired and on Medicare. And it's available to U.S. residents, U.S. citizens, and legal residents. It is an individual health program. It's not family insurance. It's not Social Security. It's not Medicaid. And it's not free. It's something that you're paying for and you continue to pay for. Who can get Medicare? Well, first of all, you have to be a legal citizen. You have to be a U.S. citizen or a legal resident. If you are a legal resident, you must be a legal resident for 5 years in order to get Medicare. And what are the age requirements? You've got to be 65 or have certain disabilities. If you're disabled for 24 months, you can get Medicare. If you have Lou Gehrig's disease, you can get it instantly. If you have end-stage renal disease, you can get it instantly. So certain conditions you can get instantly. Most disabilities, you must be disabled for 24 months. Most people who are on Medicare are 65 or older. When you turn 65, they will automatically send you your Medicare card. So you don't have to even worry about signing it up. They know where you are, and they will send you a card that looks like this. Medicare A and B. Medicare Part A, hello. Welcome. Medicare Part A is your hospital coverage. Medicare Part B is your doctor's coverage. Now, remember I told you that the life expectancy has changed so much since Medicare started, and people are living so much longer. Well, what that means is that there are fewer people working now to support more people who are retired. So what they've had to do is they've had to raise the premiums, they've had to raise the deductibles. In some cases, you could pay a lot of money if you just have original government Medicare A and B. That's why we have a number of different programs that can help you meet those needs. What does hospital insurance cover? Rooms and meals, care, all of these different things. Drugs in the hospital, lab tests, x-rays, skilled nursing services, blood transfusions, etc. Hospice, part-time skilled care rehabilitation. The problem with the hospital coverage is there's this year a $1,340 deductible. And as you can imagine, most of these services are going to add up to cost a lot more than $1,340. So you're on the hook for $1,340 unless you have something that will ameliorate that bill. And again, those bills are going up every year because fewer and fewer people are working to support more and more people who are on Medicare. Now, Medicare Part A, the hospital coverage, has no premium as long as you've worked for 10 years or longer, and most of us have worked for 10 years or longer. If you have not worked for 10 years or longer, you can still get it, but they will charge you a monthly premium for it. And for husbands and wives, wives can get it based on their husband's earnings. So and you can't be denied coverage. It's nationwide coverage per benefit period. The hospital coverage, you must be admitted as an inpatient. They don't cover observation. And you get extra lifetime reserve days. So you get a lot of coverage in A. You're just going to pay a little bit for, quite a bit for it. Part B covers your doctor's visits, your annual wellness and preventive coverage. And this is something that's interesting. When we started offering the Medicare Advantage programs about 12 years ago, Medicare didn't cover most preventive stuff, but the idea was Medicare would be competing with the private insurance companies, and to compete with the insurance companies, they now cover all the same preventive stuff that the private insurance companies cover, which is your flu shot, which is your, all your vaccinations, etc. Clinical lab services, x-rays, mental health care, diabetes screenings. Most screenings are covered at no cost. Ambulatory surgical center visits, all these things covered under Medicare Part B. That's your medical insurance. You're going to pay a monthly premium for that. Most people this year paid $134. It goes up every year. We don't know what it's going to be next year. If you say, well, I paid more than that, that's a good thing. That means you made a lot of money. So, it's adjusted for income. So if you made a fair amount of money, you're going to pay more. And I will tell you, I'm on Medicare, and I paid more money, and I'm happy to pay more money because it means I made more money. You can't be denied coverage. Coverage is nationwide. There is a penalty for late enrollment, but again, it doesn't cover everything. One of the things it doesn't cover is prescription drugs. But we have a number of different options for prescription drugs. When I got into this business, virtually nobody had prescription drug coverage. We offered the first prescription drugs back in 2005, first prescription drug coverage. And I'll tell you, these people, they wanted to kiss me. They were running up and hugging. They were so happy to get their drug coverage, because prior to that, seniors did not have any special drug coverage. It doesn't cover eyeglasses. It doesn't cover long-term custodial care, although there is a nursing home benefit. It's a short-term benefit. It doesn't cover excess charges, although some plans do. It doesn't cover care outside the United States except for emergency coverage. And how much does it cost? Again, it was $134 this year. It's going to go up every year. This is the hospital deductible. If you're unfortunate enough to be in the hospital for longer than 60 days, then they charge you $335 a day from days 60 through 90 and $670 a day from days 90 through 150. So I mean, those costs could get very, very steep, which is why most people want to have some type of supplementary coverage. And we don't have to go through the examples because you guys can understand that. The premium again is $134 for most people. If you pay $180 or more, that means you've made a lot of money. The deductible for Medicare Part B is $183. In other words, if you just had Medicare Part A and B, and you go to the doctor's office, you have to pay the first $183 out of your pocket. Virtually every program I offer does away with that deductible, so you don't have to worry about it. But that goes up every year as well. In general, Medicare covers 80%, and the client patient is supposed to cover 20%. And Medicare, government Medicare, has no out-of-pocket limit, which means you can pay and pay and pay. Every supplementary program that we have has an out-of-pocket limit, so you don't have to worry about that. But if you just had A and B, there would be no out-of-pocket limit. So you could pay that 20% until the cows come home, and you know, with medical costs being the way they are, that could be very expensive. So these out-of-pocket costs, which are rising every year, can we cover these out-of-pocket costs? Basically, we've got two options. Option number one is to buy a Medicare supplement plan offered by a private insurance company, which typically will pay most, if not all, of your out-of-pocket coverage. And you want to couple that with a Part D drug plan. By the way, I have a booklet that has I see you taking good pictures. Yeah. I have a booklet that's got an abbreviated version of this, and if you want that, I'll be happy to give it to you.
I would like that.
You need to ask. We're regulated by the government, so I can't hand out my business card or books, but if you ask me for it, I'll be happy to give it to you. So, but you must ask, that. Okay. Otherwise the government will get mad at me, and I don't want that to happen.
All right.
So a supplement insurance plan basically is offered by a private insurance company to do exactly what it says, supplement your Medicare coverage. And Part D are the plans that we began offering in 2005, the Part D drug plans, which cover most of your drug coverage. And we've got some great news for you. This wasn't expected to happen until 2021, but our government has done away with the donut hole. Starting January 1st, there will be no donut hole. So you'll have coverage all the way through. There used to be coverage at the beginning, coverage at the end, no coverage in the middle. Then they started partially filling in that donut hole. It's all filled in as of January 1st. No donut hole in the drug coverage. So that's the Part D drug plan. Now, at the same time that they offered the Part D drug plans, they came up with option number two, because these supplement plans, great as they are, can be very expensive. Typically, to get the F plan, which is the Cadillac plan, it typically costs you about $190 to $200 a month. If you're turning 65, if you're older, it could be quite a bit more. And these drug plans can go anywhere from $20 to $80, depending on your needs. So, you know, you could be talking upwards of $300 a month for coverage. And the government said, well, you know, we don't want to price people out of Medicare. These costs are only going to go up. Let's give them another option. And the option they came up with is option two, which is called Medicare Advantage. Medicare Advantage is Medicare offered by a private insurance company. Option one, you're still on government Medicare, and it's supplemented by the private insurance company. Option two, you are on private Medicare. You are delegating the insurance company to provide your Medicare 1 year at a time. Many providers call this a Medicare replacement plan. We don't like to use that term because you can always go back to government Medicare. It substitutes for your government Medicare. Replacement kind of sounds really permanent, you know, so we call it Medicare Advantage plan. You can always go back. Every year you have a chance to go back to your original Medicare if you have a Medicare Advantage plan. Medicare Advantage plans give you medical coverage, Most of them give you Part D coverage. Most of them give you many extra components that Medicare doesn't even give you. And many of them, especially in our area, we are blessed to have many people on Medicare in Southwest Florida. So we have many, many plans that have zero premium. And people look at me and say, zero premium? You're giving me something for free? How can this be free? I mean, well, it's not free. That's why we don't call it free. It's zero premium. It's basically something that you've paid for and you're continuing to pay for through your Medicare funds. What happens is, when you go onto a Medicare Advantage plan, your money that has gone and continues to go down to Washington is funneled back to the insurance company, and the insurance company can provide your coverage. They're getting your money, you're having the insurance company spend your money rather than Uncle Sam spend your money. And they've figured out ways to do it, and a lot of that is through scale. There are millions and millions, 30 million people have Medicare Advantage plans. And you know, Sam Walton, who was a great marketer of our time, once said it's a lot easier to sell 1,000 people something for $1 than one person something for $1,000. And that's the principle. The principle is scale. They're getting so many payments for so many people that they are able to do this at a very reasonable premium, with the reasonable premium being zero in many cases. Now, if you need extra coverage, there are plans that do have a premium as well, which will give you extra coverage. So basically two options, you know. Depending on your needs, depending on your economic situation, option one could be the right option. If you're very well off and you think you've got substantial needs, option one is the way to go. If you don't have substantial needs, or you're more challenged financially, option two may be the option to take. One thing to remember too is that if you do not take option one, later on in the state of Florida, you may have to go through medical underwriting to get option one. So that's another factor to take into consideration. Again, we offer option one and option two. There is no right, there is no wrong. It all depends on your needs and your ability to pay. Whoops, sorry. Medicare Advantage, again, it's another way to get your Medicare coverage through private insurance companies. And it gives you, and by law, Medicare Advantage must cover everything that original Medicare, government Medicare covers. The cost sharing will likely be different. In most cases, it will be better, but they must cover all those benefits. Many of them cover prescription drug coverage, so you don't have to get that extra Part D plan. And many of them cover dental exams, eye exams, hearing tests, wellness and fitness programs. We have a number of plans that give you a no-cost gym membership. Now, again, I didn't say free, not allowed. We call that the F word. We're not allowed to use the word free. A no-cost gym program, which is great, which I need. But and what types of plans do they have? Well, most of the Medicare plans, we will tell you, have networks. They're either HMOs, health maintenance organizations, or PPOs. Now, there are still some point of service plans in which are kind of like you can go anywhere, but you pay a little extra. They're kind of like a PPO. So there are special needs plans for people who have chronic illnesses or who are on Medicaid, and the other types are private fee-for-service plans, which we typically do not have in this area, and medical savings account plans, which again we typically don't have in this area. Most of the plans we have in this area are either HMOs or PPOs. Now, and the difference, I may be covering something that is going to come up later, but the difference between an HMO and a PPO. Does anybody know the difference between an HMO and a PPO? HMO, you must go in network. You must stay in the network, And typically you have to get a referral for a specialist or for a special procedure. Now, typically, again, that's not hard to get, but you have to jump through a few hoops. They want to make sure that you need the coverage. In exchange for that, they typically have lower copayments. A PPO has a network. You can go in-network or out-of-network. You'll pay more if you go out-of-network. You never have to get a referral for a PPO, and you don't have to get prior approval for a PPO as well. So people who want a little bit more freedom and are willing to pay a little higher copayments will go with the PPO model. People that want to get the lowest possible copayments and their doctors are all in network, they go with the HMO model. To get Medicare, you must be enrolled in Medicare Part A and Part B and live in the service area. That's it. And we will deal with anybody who lives in Medicare Part A and Part B and live in the service area. I'll tell you a little story. I gave one of these presentations at a place one time, and a couple of days later I got a call, and the guy said, "Is this Dave?" I said, "Yeah." He said, "My girlfriend saw your presentation, and she was very impressed. I'm interested in getting a plan. I'm going to be moving to Southwest Florida." I said, I gave him my number, my information. I said, "Call me when you get to Southwest Florida." No more than 10 minutes later, phone rings again. I'm watching a ball game, so I say, "Oh, who is this?" And I'm calling, you know. And the guy says, "That's me. I just called you." I said, "Yeah." He said, "There's one thing I forgot to mention." And I'm from New Jersey, but I've lived a very sheltered life, so I've never met anybody like this before, but this is what happened. He said, "I just want to let you know, I'm transsexual, man to woman." And you know what I said to him? "Do you have Medicare Part A and B? Do you live in the service area?" He said, "Yes." I said, "Fine, give me a call when you get to Florida," because we deal with everybody. He never did call me, so it may have been a government plant trying to see how I would react to that. They're not above doing that to us, you know. But now, how to get your Medicare drug coverage? You can either get it as a standalone Part D plan, which typically if you have a supplement plan you will get, or you can get it as part of a Medicare Advantage plan. We do recommend that you get the Part D coverage even if you don't take medications, because the Part D plan has a very stiff penalty. It's 1% of the average cost of a plan per month, which only comes to about 31 cents a month, but that comes to $3.60 a year. And if you multiply it by several years, it could be $30 or $40. That penalty sticks with you for the rest of your life. When I trained and learned this stuff, I had a fellow from Queens, and they used to drill us on how long is the Part D penalty, and he used to say, "Forever," because it is forever. So you want to get a Part D drug plan even if you don't take many meds now, because who knows, you may take meds in the future. Every Part D plan has a formulary, which is a list of drugs that are covered. Every formulary must cover drugs in every therapeutic category. So you should be able to find drugs in your therapeutic category. And if you absolutely need a drug that is not in your therapeutic category, we can help you file an exception. We've done that many times. An exception to the formularies. The drug companies and the government want you to get your medications. They do not want you to get sick and possibly die because they're withholding medications. That would be a disaster. So you will get your medications one way or the other. And when you sign up with us, what we do is, again, we're not trying to give you any commercial here, but we do those types of things for you. We call up, we make the calls. Service is our motto. Service is our business. We get back to our clients within 24 hours because we get paid for signing you up, and you provide us our income. So how do these work? Well, typically they have 5 tiers. Generally, tiers 1 and tiers 2 are generic drugs. Not always, though. If you have a very expensive generic drug, it could wind up in tier 3 or tier 4. Many of the tier 1 drugs are very inexpensive. Some of them are 0. Tier 5 are specialty drugs. And what we do is when we sign you up, we check your drugs and see what tier they're in, so you're not going to be surprised. It's not in anybody's interest for you to be surprised. We want you to know what to expect, because we don't want to get you mad, because we get a commission not only the first time we sign you up, we get a commission every year that you stay on the plan. So our goal is to keep you happy for the rest of your life and the rest of my life, whichever comes first. Now, the stages of coverage. Again, this is a little dated. The donut hole is gone. Ignore that. The initial coverage for 2018 was up to $3,750. That's where you pay your little co-payments, which may be $0 for a certain drug, or $5 or $10 during the initial coverage period. After that, you will pay 25% for all your drug coverage up to $5,000 in out-of-pocket costs. So that is considered to be closing of the donut hole. The government and the insurance companies pay 75%, you pay 25%, which will be hopefully very inexpensive. If you're unfortunate enough to have $5,000 in out-of-pocket costs, that's a lot of money. That's your little co-payments plus the 25%. If you reach that, then you're only going to pay basically 5% or minimums of a couple of bucks for your drugs. That's called the catastrophic stage. We hope that you don't get there, but if you do, you've got fantastic drug coverage at that point. And to get drug coverage, you don't even need to be enrolled in Part A, you just need to be enrolled in Part B, but entitled to Part A. And most of these drug plans also have pharmacy networks, so it's always better to go to the network pharmacy. You're going to get a lower price. My plan last year we went to Walgreens, then they changed it to CVS, so now I go to CVS. All these drugstores are all around here. I go one block farther to go to CVS, but I save a lot of money, so you want to use the network pharmacies if you can. Again, a Medicare supplement plan, which is called a Medigap plan, supplements your Medicare. They're standardized benefits offered by private insurance companies. They are graded A through J, and every A plan is the same as every other A plan. Every F plan is the same as every other F plan. And they will help you to pay for your Part A and Part B deductibles, co-insurances, hospital costs, etc. Everything is on this page. And these are the plans. Most people will get the F plan. The F plan, we call it the Cadillac plan because, like a Cadillac, it covers everything. 100% of everything except for foreign emergency coverage. It covers 80% of that. But these plans are standardized. And after 2020, the F plan will be going away. But anybody who is entitled to get an F plan until 2020 can still get an F plan after 2020. But the government wants to do away with what they call first dollar coverage. With the F plan, you don't pay a penny on anything, basically. And they want to do away with that. They want everybody to have some skin in the game. So after 2020, new folks will not be able to get the F plan, but people who are 65 now will be able to get it forever. You don't have to get it before 2020. But they come in various flavors. For less price, you can get half coverage, you can get 1/4 of the coverage. The second most popular plan is the N plan. The N plan, you've got a couple of co-payments and typically costs about $60 less than an F plan, but we go through that with you if you think you need a supplement plan. One of the advantages of supplement coverage is supplement plans are accepted virtually every place. There are no networks. Anyone who accepts Medicare will typically accept a Medicare supplement plan, as long as it's by a reputable company, and all of ours are by reputable companies, so that should be no problem. And again, you just need to be enrolled in Medicare Part A and B. Now, I talked about medical underwriting. If you're within 6 months of your 65th birthday, there is no medical underwriting, so you must be accepted regardless of your medical conditions. Premiums will vary. How do I choose? Good question. These are the combinations. You can get Part A and Part B and have all those out-of-pocket costs, but no upfront costs except for the B. You can have A, B, and a D, which will give you drug coverage. You can have A, B, a D, and a Medicare supplement, which is a very popular option. Or you can have A and B with a Medicare supplement and not have your drug coverage. With the Medicare Advantage, you can have the C and the D together, which is typically what we sell. Or you can have a C without D. Or you can have a C and, in some cases, a standalone D. But again, the most popular options here are option number 3 and option number 5, which give you everything in one form or another. And again, those are your options. This is original Medicare, Medicare Supplement, Medicare Advantage. Now, at this point, does anybody have any questions? Because one of the things we want to do here is to explain the difference between original Medicare, Medicare Supplement, and Medicare Advantage. Anybody have any questions on this? Yes?
And I'm probably just not understanding.
It's okay.
Why would you need Part D if you have Medicare Advantage? It covers drugs, correct?
In most cases it does. In some circumstances, if they want a different Part D plan and they have a PFS plan, it only works with a PFFS plan, they can get that, but typically they would not want that because it will be included in the Advantage plan. You're correct.
Okay.
Any other questions? Everything seems to be clear so far. We're almost done. So again, I've gone through some of this before. Typically, networks are one of the big differences. Is no network in a supplement plan. Networks typically with the Advantage plans. When can you enroll? You can enroll when you turn 65. You can enroll 3 months before you turn 65, 3 months after 65, or the month that you turn 65. These are all open enrollment periods. Beyond that, there is a general enrollment period for Part A and Part B of January to March. And if you enroll in Part A and Part B between January and March, you can enroll in Part C and Part D between April and June. However, you can change plans. Most people enroll when they turn 65, and then they change plans during what we call the annual enrollment period. The annual enrollment period extends from October 15th to December 7th. Every single year. It's a 7-week period in which you can change your plans. And typically, unless you're very happy with your plan, it's a good idea to review your plan during this period. And people like myself are happy to review your plans with you. And if you're happy with your plan, if we think your plan's the best plan for you, we're going to tell you that. And you can keep your plan. But if we got something better, we'll tell you that too. This year, the government has added an additional period. So 7 weeks was a very short period. So the government has given us an additional 3-month period from January 1st to March 31st where you can still change your plan. So we're looking forward to that. We're not going to be all bunched into the October 15th to December 7th plan. There are penalties if you enroll in Medicare B late or A late. Typically people do not do that because when you go on to Medicare, they send you a card which says A and B. You're automatically enrolled. You can opt out of B. Typically people don't opt out of B. Typically the penalties only come into play with the Part D coverage when somebody says, hey, I don't take any drugs, I don't need a drug plan. And then 4 years down the line they say, oh, I better get a drug plan. Then they're going to be penalized forever.
Hey, forever.
Yes?
Have they gotten the new card? Anybody got the new cards yet?
The cards are, I haven't gotten mine. They're coming out very slowly. But I think maybe a quarter or a third of the people have gotten them. I don't know anybody in Florida that's gotten them yet. But we are getting, everybody is getting new Medicare cards because The problem with the existing Medicare cards is they've got your social security number on it. You know, talk about identity fraud, right? You know, so finally the government decided we're going to give them a number without their social security number on it. So you're going to be getting a new card sometime within the next year. But to answer your question, Gary, no, I haven't seen any in Florida yet. Special enrollment periods, if you move, typically the most popular ones are if you move out of the state or out of the coverage area, you can get a plan. You can enroll in a plan at that point. Within 2 months of your moving out of the plan, move out of the service area. Also, if you lose employer coverage, you can enroll at that time as well. If you go into a nursing home, if you lose your drug coverage, if you're on a state-sponsored pharmacy plan, which we don't have in Florida, or if you move back from outside the country, these are all instances outside of the normal enrollment periods in which you can enroll. So if you come from New York or Pennsylvania and you say, hey, they don't have my plan down here, even if they have your plan, you still have to re-enroll in a Florida plan because all health insurance is state-specific, which means you move to another state, got to get a new plan in that state. And how can you save money? Use your benefits wisely. Use your preventive services. I go to see my doctor every 6 months. Doesn't cost me a penny. Stay in the network. Use generic drugs whenever possible. Use mail order services whenever possible. And understand your status in the hospital. These things will save you a lot of money. If you need assistance, which I don't think anybody here does need, but you can call Medicare, 1-800-Medicare, or you can call your county, you can call your state, and we can help folks do that as well. And those are where you go for help. That's basically it. They're having a National Medicare Education Week, which we don't have to worry about. These are your resources, Medicare.gov, 1-800-Medicare, your state health insurance program, or your local Social Security or Medicaid office. That's basically it. If anybody is interested